abdominal pain. That is discomfort between the chest and the pelvic. It is common, and it can be because of excessive alcohol consumption, or unwisely eating, or tumors, or anxiety, or it can be also commonly a part of menstruation or accompanied with menstruation. It can be also more serious with endometriosis. It can be because of cystitis, because when there's obstruction for the urine to be passed, and it can be because of peptic ulcer, and it can be that there is a volvulus, so twisting in the intestine, and then there's ischemia, not sufficient blood supply. It can be that there is an organ having muscular spasm because it tries to overcome a stone or an area of inflammation. And if it is not so strongly, here is recommended to have a hot water bottle. If it is stronger, then medical attention should be sought, and also if it is accompanied with fainting or sweating, or if it is not released by vomiting, or if there is persistent vomiting, or vomiting with blood, or blood in the feces. And there are also, against peptic ulcers, antacid drugs. And there can be done examinations. There can be done colonoscopy, gastroscopy, ultrasound, laparoscopy, and that is according to Illustrated Medical Dictionary written by Sue Davidson, Penny Preston, and Francis Williams on page 4. But this is no substitute for medical knowledge, or it is also not medical advice. Hi and welcome. I'm trying to learn medicine today, abdominal pain, and after we've done it, we're going to do hip training. And if you participate in hip training, this is at your own risk. We're going to talk about multiple diseases, internal anatomy, the blood system, the digestive system, and so on. And this is no medical advice. I'm just trying to read it to understand it. Abdominal pain, we're reading it the second time. Abdominal pain, discomfort in the abdomen. So it is discomfort in the abdomen, that's the region between the chest and the pelvic. Mild abdominal pain is common and is often due to excessive, so it is common. It is a common thing. It can be because of excessive alcohol intake, because of eating unwisely, I think they're meaning too much, but also the wrong thing. And also it can be an attack of diarrhea. Pain in the lower abdomen is common during menstruation, but is occasionally due to a gynecological disorder such as endometriosis, endometriosis, Okay, it can be a part of menstruation, but it can be also something more serious. I think it is more serious due to the gynecological disorder such as endometriosis. Let's think so. We're having alcohol, we're having an attack of diarrhea, we're having unwisely eating, and then we're having menstruation or also severe endometriosis. Okay, and when cystitis is a common cause of pain or discomfort in the abdomen. Bladder distension as a result of urinary obstruction may also cause abdominal pain. Cystitis was a thing of bladder. We looked it up in the last part. Let's look at it again. Cuticle. Let's read it. You want to know it. The outermost layer of skin. The term commonly refers to the thin tab of skin at the base of a nail. The term commonly refers to the thin flap of skin at the base of a nail, and also to the outer layer of a hair shaft. Okay, the last part of skin coming down onto the nail. The last part, there, that millimeter. And also the outer layer of a hair shaft. So not the hair, but where the hair is growing out. Whatever, it is cuticle here in medical, okay. Now, what is this? Where's the other thing? Cytosis. Cystitis, inflammation of the bladder lining, usually due to a bacterial infection. Okay, it can be endometriosis or cystitis, where the lining of a bladder can be infected. The result of urinary obstruction may cause abdominal pain. Abdominal colic is pain that occurs every few minutes as one of the internal organs goes into muscular spasm in an attempt to overcome an obstruction such as a stone or an area of inflammation. The attacks of colic may become more severe and may be associated with vomiting. So then abdominal colic, where the organs can have muscular spasms every few minutes because we're trying to overcome a stone or an area of inflammation, which can also lead to vomiting. Peptic ulcer often produces recurrent gnawing pain. Other possible causes of abdominal pain are infection, such as pyelonephritis and ischemia, lack of blood supply, as occurs when a volvulus, twisting of intestine, obstructs blood vessels. So when having peptic ulcer, that is just gnawing pain said. Peptic ulcer, then pyelonephritis. I don't think I should even try to remember it. It's too much, I'm going to forget something else from it. Pyelonephritis. Peptic ulcer, pyelonephritis, but also ischemia. There can be a lack of blood supply because of a volvulus. A volvulus. Volvere means turning, revolution. Something turns. So volvulus. Twisting of the intestine, obstructs blood flow. Tumors affecting an abdominal organ can cause pain. Also, tumors can affect. Abdominal pain can also result from anxiety, so tumors and then anxiety. For mild pain, a red hot water bottle is often effective. We don't want to go into medical advice so much. Maybe we're going to say mild pain, hot water bottle, which is properly handled. Pain due to peptic ulcer can be temporarily relieved by food or by taking anti-acid drugs. There are anti-acid drugs and hot water bottles. Abdominal pain that is not relieved by vomiting persists for more than 6 hours or is associated with sweating or fainting because urgent medical attention. If it is some abdominal pains are indicating that urgent medical attention is necessary. Urgent attention is also necessary if pain is accompanied by persistent vomiting of blood or passing of blood-stained or black feces. Unexplained weight loss or changes in bowel habits should always be investigated. I don't know if I want to include it in the explanation. Yes, I want. Okay, so hot water bottles, anti-acid. If it doesn't go away, basically, and if there's sweating or fainting, urgent medical attention. If there is any type of persistent vomiting of blood, passing of blood-stained or black feces, urgent medical attention. And if there's unexplained weight changes or changes in bowel habits, also investigation. Investigation of abdominal pain may include the use of imaging tests such as ultrasound, endoscopic examination, gastroscopy, colonoscopy, laparoscopy. I'm not able to remember more. So ultrasound, endoscopy and gastroscopy. That makes sense. Colonoscopy and laparoscopy. But what is laparoscopy? Laparoscopy, examination of the interior of the abdomen using a laparoscope, which is a type of endoscope. Laparoscope is widely used in gynecology. Surgical procedures such as appendicectomy or cholecystectomy are now often performed laparoscopically. Whatever, some type of looking for something. Where it is here, so this is the graph which I can't show on the internet. What is vaginal laparoscopy? Where's the laparoscope? I don't want to explain it in case we don't understand it wrong, but I think I understand it wrong. Okay, we're gonna do it later. It's too graphic for now. And maybe I understand it wrong so fast. I don't want to scare people. Now, ultrasound, endoscopy, gastroscopy, colonoscopy, laparoscopy. I be able to say it all. How about we doing it the second time? We're going about all the second time. I'm almost able to make it in a presentation to list 90% of it, but how about just do it the second time with the original source? That means, that was the about. If you were here for medicine, you can go directly to an expert of medicine, where we at one point can read it all again, and then make a representation. Basically the same we just did, just a bit better, probably, hopefully. If you stay here and participate in the hip training, then it's at the outlook. We're having the feet sitting together, and the toes are opening, and the other toes. The heels, toes, and so on, as far as you can go. And again in, toes, heels. Stay with the knees down. And up. A bit apart with the legs, a bit down, legs for legs, press them together, straighten one leg. Bend it again. Straighten the other leg. Bend it again, and up. A bit apart and a bit down. Flex the legs, press them together, go over to one side. Over to the other side. Straight, middle and up. A bit closer together, press to the other side. And now one leg up, leg to the side, very good. Out middle and down. Another one up, side, very good. Middle and down. And leg to the side and up. And other leg to the side and up. Flex the foot when it's up. One hand on tummy, one on lower back. Lift the leg in a straight line up. Pull the toes in. And pull the leg. The other leg up in a straight line. And one leg up and press up to the side. The other leg up to the side. And one heel to the ground. Don't do it if you're pregnant. Lift the heel off the ground, place it again onto the ground. Other side. And stand good on one leg. This can go to the knee. Turn over to the leg. Down. Punch out over. Up again. Change the leg. Stand good. Turn over. Down. Again over. Up. And stand good. And reach with the heel always to imaginary 90-minute intervals on an imaginary dial. The other leg, front, and so on. To 10:30, 9 o'clock, 7:30, and 6 o'clock, 4:30, and 3 o'clock. And now one leg up, down. The other one. Legs to the sides, you can come up with the arms. Out, sink again, sink down, hands onto the ground. Leg up, roll, slowly up again. At the top, backwards, shoulder roll. And the arms up. Hold, sink down. Hands onto the ground. Leg up and roll, slowly up again. Backward shoulder roll at the top. Have a good standing leg and a seesaw airplane. Arms to the sides. Go back with the leg up. And again back. And again. And back. And again out. And now hiding airplane, pull the knee in and again out. And back into the middle, the other leg, back with the leg, and back it. And bring it out. And pull the knee in and out. Exercise, breathing it out. And out. And in. And out. Breathe in and calves relaxed. And breathe in and out. It was hip training. I thank you very much and until next time.